All right, good evening and welcome. This is the I Am Abel Foundation's Medicine Makers. Welcome to tonight's episode, where if your destination is a career in medicine, we're going to show you how to get there. I am your host for the evening, Dr. Renee Roberts, board certified in family medicine, and we have a fantastic show for you this evening. We have the lovely and dynamic Dr. Erika Goodwin, who is double board certified in child, adolescent, and adult psychiatry. She is also a best-selling author and integrative life coach. So welcome to the show, Dr. Erika.
Thank you so much. I'm glad to be here.
Thank you. So we will get to our discussion with Dr. Erika in just a second, but of course we want to welcome all of you to Medicine Makers. You are watching us on Chicago's CAN TV, channel 21 on cable, AT&T channel 99, and if you're watching us online, welcome. You can find us at www.cantv.org/hotline. As well, this is a live call-in show, so if you have a question for Dr. Erika, please feel free to dial the number that you see on your screen, 312-738-1060. Just a little bit of information about the I Am Abel Foundation. We are a nonprofit organization based here in the Chicagoland area, and our mission is to increase underrepresented minorities in medicine. So we actually pair them with physician mentors and help guide them through their process to becoming doctors. We actually work with high school, college, and post-baccalaureate students. So if you are interested in learning more about the I Am Abel Foundation, please feel free to check us out online at www.iamabel.org. And Abel is spelled A-B-E-L. Okay, well, let's dive into our show tonight. Welcome again.
Thanks.
Dr. Erika, again, as I mentioned, she is double board certified in child, adolescent, and adult psychiatry. She has a fantastic show for us this evening. We are going to be talking about mental health and mental wellness and how to ask for help. An excellent topic. So welcome to the show, Dr. Erika.
Thanks again for having me.
Okay, well, let's have the audience learn a little bit more about you. How is it that you came to become a child, adolescent, and adult psychiatrist?
Thank you. Well, the interesting story about this is I started out wanting to be a pediatrician since I was around 3. I had been a sickly child, had bad allergies, bad asthma, and I just knew I was going to be a pediatrician. Then I went to medical school, and you've been to medical school, but if you haven't been to medical school, the first couple of years you do just general clinical work, and everybody pretty much does the same thing. And then your third and fourth years, you start doing things in the hospital, and you may do some things that are more specifically tailored to what you want to do. Well, I woke up the summer before my third year of med school, just with an epiphany.
Uh-oh.
No information, no reason why. With this idea, I was going to be a child psychiatrist.
Oh, wow.
So later I found reasons, but originally I just woke up with an epiphany that that's what I was going to do. So then I found lots of reasons. It's great because psychiatry feels like something that actually touches people's spirits and soul. You actually get a chance to get to know people, and in today's world, sometimes the visits with the doctor are a little bit quick. So I wanted something where I could really forge relationships with people and get to know them. So, and the other thing is when I was, a lot of you, when you go to grad school or even med school, you have to write a personal statement. And in my personal statement, I wrote, there was this book by Nathan McCall called Makes Me Wanna Holler. And in this book, he talked about how people need to get checkups with their mental health like they do with their physical health. Kind of like you get a physical and those things yearly. And he talked about how it would be useful if people get those kinds of checks. So I kind of fell into it and then found a lot of reasons.
Well, thank you so much for that lovely introduction. I would definitely have to agree with you that mental health is equally as important as our physical health. Both as doctors here, we know we oftentimes will see people wanting to come in for just physical ailments, aches, pains, chest pain, diabetes, that type of thing. But oftentimes when we start having the discussion about mental health, everything falls silent. It's like the big pink elephant in the room, and there's still a lot of stigma attached to that, unfortunately. So we're hoping to dispel some of that here today. So segueing into that question, why don't you share with our audience, or please explain to us why mental health and the concept of mental wellness, why is that important?
Part of the reason it's really important is all of these things, people look at it, they'll say there's mental health over here and your physical health over here, and they're actually very, very, very much connected. So what you feel from a mental health perspective, there are times where, for the average person, have you ever felt really nervous or really worried, and then you had a headache or a stomach ache?
True.
Is that a lot of times if you're mentally a little bit or emotionally unbalanced, your body will send you a signal. So those mental health issues, or even if it's not to a level where you have some diagnosable disorder, is that can lead to a point where then someone's other illnesses, or they may get something, and it's really because of their mental health. So you'll see people whose sugars go up because they're stressed. You may see people with heart palpitations or chest pain, and they have anxiety, or people who have more stomach or GI issues and they're depressed. And on the other end is that when people don't emotionally feel well, they typically aren't taking as good of care of themselves physically. So a lot of times we look at it as kind of the mind, body, spirit all being connected. And the reason why mental health is so important is to help you feel whole and feel good. I'd say one example is, has anybody ever been in like a low income area and the people are happy, sitting on the balcony, having the time of their life? And then you'll hear about these people that are wealthy and superstars, and they're miserable and depressed.
Yes.
And a lot of it just has to do with what people's mental wellness and what their mindset is.
Fantastic. That is so true. I think I know personally I see a lot of that in the office. The patients may come in with physical complaints, heart palpitations, back pain, aches, that type of thing, and it's not necessarily an underlying physical condition. There's actually a link to unresolved behavioral health or mental health issues. So that is definitely an excellent point. You are double boarded in child, adolescent, and adult psychiatry, so I can imagine you have seen a lot. Have probably treated a lot.
A little bit.
Just a little bit, okay. So what are some of the challenges that you have run into, particularly that you've run into with your practice in terms of getting your patients to open up and talk to you about their mental health issues or concerns?
Well, one of the first sets of challenges a lot of people have is, number one, feeling that they don't have a mental health issue to begin with. So they may not be open or approach one of us because they're thinking, there's nothing going on with me, or whatever's going on is my physical health, or this is something I should get over. I don't have a mental health issue. So the first issue is they don't believe either they have one or that it exists to begin with. The next is sometimes people are very, very concerned about privacy. They're very concerned of whether or not the information you tell them will impact them other places, be it at work, or if they have children, will something be reported and their kids be taken away. So they're very, very worried about privacy. The next is just sometimes people don't understand how serious it is. And then there are some illnesses where people perceive that they actually feel good, such as mania. So they don't recognize that there's a problem because they're like, I feel great, I have so much energy, I feel so creative, I get so much done, that they're not looking for help because they think they're okay.
Could you explain to our audience a little bit more about exactly what mania is?
So a lot of times people, there are terms, I'm going to warn you, there are terms that people use casually, that the way we use them as mental health providers is very different. Some of those include schizophrenia and bipolar. That people will say anybody with mood swings has schizophrenia. That's not what schizophrenia is. Mania is a part of the construct that is around what we call bipolar disorder. And partly it got its name because of two poles, one up, one down. So people can feel up and people can feel down. Now, the part that's confusing is a lot of times when people hear about mania, they think of the person that has a lot of energy. You know, one of the classic symptoms is you don't need sleep. You just have a lot of energy and you don't need any sleep. But classically, they look at it with the term called euphoria, like someone is super, super, super happy. But the flip side is actually in the clinical criteria is someone can actually be extremely irritable too instead of super happy. But typically people are impulsive. They'll do things they don't usually would usually do. They'll spend money they don't have. They will become more sexually promiscuous, maybe say or do things they wouldn't usually do. And you'll just see these huge changes in behaviors, but they're typically mania is a little bit more time limited. So it tends to be episodic.
Okay, well, thank you so much for sharing that information with our audience. You all are watching Medicine Makers here on CAN TV, Chicago Channel 21, AT&T Channel 99, and we are streaming live online at cantv.org/hotline. I am your host, Dr. Renee Roberts, and this is our lovely guest for the evening, Dr. Erika Goodwin, or she said we can just call her Dr. Erika. She is double board certified in child, adolescent, child, adolescent, and adult psychiatry, best-selling author, and integrative life coach as well. So thank you again for being with us. We're going to go ahead and continue our discussion. So I know that you mentioned that you work with children as well. What are some of the most common diagnoses or things that you see in the children that you work with?
So probably the thing we see the most common with children is going to be more ADHD and some depression. Now, I'd like to quickly say that being a psychiatrist, a large amount of mental health treatment goes on in the primary care office, so like places where Dr. Renee is. So a lot of times it's not uncommon that some of the more difficult cases are what comes to us because someone's pediatrician or family doc or something like that has taken care of somebody that was rather straightforward or simple. So we typically see probably more ADHD, some depression. And then there are things we see that aren't specific diagnoses. So we see a lot of trauma reactive behavior. And there are times where people have behavior that is related to trauma, but may not necessarily have all of the symptoms of PTSD. So we'll just say trauma reactive behavior.
Oh, could you talk a little bit more about that? That's a very interesting topic.
Okay, so there are a lot of reasons people may experience trauma. Classically, when PTSD they started talking about the first time, they started talking a lot about veterans and people that had war exposure, but there's a lot of other kind of trauma exposure people have, such as domestic violence, abuse, accidents. Now you see, just the exposure from TV of mass shootings, people being scared of what's going to happen to them when they walk down the street, if they live in dangerous communities, even the amount of intense racism, people can feel traumatized by it. So there are a wide variety of things that people can feel trauma from. And what ends up happening with trauma reactive behavior is people are having, it's literally descriptive, behavior that is reactive to trauma. So it can be sometimes sadness. A lot of times in kids, you'll see irritability. You can see changes in sleep, impulsivity, sometimes even aggression, but sometimes it's not at a level where someone actually has diagnosable PTSD, but they are having some difficulties that can be worked on.
Okay, thank you so much for clarifying that. And PTSD, for those of you that do not know, stands for post-traumatic stress disorder. Okay, well, I have a question for you. So there obviously is a lot of stigma in many communities about mental health, having mental illness. I think it's probably safe to say that there is someone that we know, whether it's in our friend circle or family circle, maybe even coworkers, that are affected or even have some form of mental illness, even if they're not being very forthcoming with that. With that stigma, a lot of times people don't want to admit that they need help or are embarrassed or don't know where to go for help. So what advice would you have for the person that's watching, either it's themselves or maybe a loved one, a spouse, that they have suspicion that maybe there is some behavioral health or mental health issues? What type of resources are available to them?
So there are numerous resources, and when dealing with these things, especially if it's a loved one and they may not understand as much of what's going on, or just they've been dealing with it so long that they're not thinking about it being as much of a difficulty, is the first thing I'd advise people is, if you're trying to support a loved one or even a coworker, is you approach it from a standpoint of I'm probably a little bit touchy-feely. So I'd say you have to come from a space of love and understanding. So a lot of times it may be a situation where you need to say, I'm really worried about you. This is what I've been seeing. It may be helpful for you to get a little help. And sometimes when you go descriptive instead of saying, hey, I think you have a depressive disorder, I think you are bipolar, that people are a little bit more receptive. Now, the tricky thing with getting help is within mental health, there are a lot of different types of providers, from psychiatrists to, then you have people talk about therapy and they're like, well, who does therapy? Well, it can be a psychologist, which typically those are going to be master's or PhD levels. You also have social workers that do therapy. And then you also have some psychiatrists do therapy, and trying to decide whether or not someone may need a therapist or may need medication management, because out of all of those, the only one of those that specifically does medication management is psychiatrists. But psychiatrists don't exclusively only do medication management. I think that's the other message, is that we do more than prescribe medication, because a lot of people are scared that if they go to a psychiatrist, a lot of times what I hear is they're like, I don't want to go see one because I'm going to get drugged up.
Okay.
And my personal feeling about medication is minimal medication for maximum effect. It doesn't do me any good if I give you medicine if you don't need it. So I don't want to give people any medicine that they don't need. And, I think the main thing is to get a really good assessment. And a lot of times the first places to go is sometimes you can call your insurance company and see who's on panel or who will they cover. You can ask, most people have a primary care doctor. You can ask them. A lot of people will also ask family and friends if they know of anybody. There are websites such as NAMI, the National Alliance of Mental Illness, so NAMI.org. They have a lot of information for people. It's a more consumer-driven organization, so it's not specifically like psychiatrists or psychologists. It's the community, people that have suffered with mental illness, people that have supported mental illness, or family members, and they have a lot of really, really good information.
Okay, excellent. Well, guess what? It's a call-in show. So guess what? We actually have a caller, so we are going to go ahead and take that phone call.
Hi, this is Helen calling in from North Carolina. And what I would like to know is, what can we do in our community where a therapist or psychiatrist visit would be more accepting? I stayed in a marriage situation past the expiration date, and as a result, I have anxiety disorder. But how can we help our community to better understand? That's my question.
Okay, thank you so much, Helen, calling in from North Carolina. Okay, so Dr. Erika, that is for you.
So one of the things that can be done is, one thing that's helpful, and I think it's something more relatively new, is that, number one, mental health has been talked about much more, even on television shows or things like that. So people are starting to have a face to see that it's, I think before the picture of mental illness was someone's uncle or old person that was locked in a back room that nobody ever talked to. And that seemed to be the picture. But I think a lot of it is, number one, going to these different resources to get information, then having people that are actually educated and informed speak in the community so that people can see that, like for us, I don't know how often people say, well, I knew there was a Dr. Goodwin. I didn't know that was going to be you. Or you don't look like a psychiatrist. And I'm sure Dr. Renee gets, I didn't think you were going to be my doctor.
Absolutely.
And I think people don't know what we look like, so they build this picture of this scary person up. And by putting us in the community, we can have these conversations directly to answer people's questions in regular people language. Because I think the other thing is, people are so used to doctors and even PhDs talking in their professional language. And our professional language is not what I would have a conversation with my mom or Big Mama or, the person down the street that asked me a question. That's not the language we would talk in. And I think the thing is us getting into the community to have conversations in language people can actually digest. And one of the things that myself and another group of psychiatrists did, we formed an organization called Global Health Psychiatry, and we wrote a book that literally broke down mental health in a question-answer format in regular people language. So it was like if you had a conversation with one of us at like the coffee at the coffee shop or at the kitchen table with a cup of coffee, a glass of wine, what would happen if you had that conversation? And the book is called Mind Matters, a resource guide to psychiatry for Black communities. And it literally breaks down all those things, question answer format, along with what questions do you ask your doctor, medications, non-medication treatments, so that people have something that they're armed with knowledge to advocate for themselves. Because I think the first thing is people need the knowledge, and then they need some skills to help advocate for themselves.
Fantastic. All right, caller, thank you so much for calling in. I hope that Dr. Erika was able to answer your question. It is almost time for us to wrap up, but we have a few more minutes before the end of the show. But I, think that you've obviously made some fantastic points. I would encourage patients to speak up, ask for help. I know it can be scary. I know it can be intimidating. Oftentimes, I feel, and you might obviously have the same experience too, that patients want to put their best foot forward. They will come to the doctor's office and want to present themselves in the best light, and sometimes they can be a little hesitant to share information with you. That happens with me in my practice quite a bit, and it takes some time to build some trust with your patients. But I encourage the healthcare practitioners out there, physicians, nurse practitioners, physician assistants, even nurses too, anyone that is having patient interaction, but particularly for those primary providers that are offering care to their patients, have the conversation with your patient. They may not always want to be forthcoming, but spend just a little bit of time during your office visit asking them how things are going, how are things at home, that type of thing. Okay, Dr. Erika, so what other things, when you're not seeing patients, because this lady is busy, she is on the go, but when you are not seeing patients, what other things do you enjoy doing, or what other projects are you working on?
Thank you. So there are some other projects I'm working on. I'm really excited because February 5th I released a book. So it's called Fix Your Fairy Tale, A Woman's Guide to a Great Life, Love, and Legacy, and it centers around the other love of mine, which is being able to empower and help women that have been working really hard, but then end up feeling frustrated by the fact that the things they were taught to do are not happening, so that they're working hard, checking all the boxes, but then are feeling very bad because they may not be married or have children yet, or feel unappreciated or unseen. So I wrote that book, and I also got into some integrative lifestyle coaching. So it's nice to, it goes like a companion with, on one hat I'm a psychiatrist, and on the other hat I'm helping women that aren't necessarily dealing directly with mental health issues.
Okay.
So all of it works together to help people have better lives.
Excellent. Well, real quick, for those of us who do not know what an integrative life coach is, could you explain what that is just a little bit?
So what I do is a version of mindset coaching. So you work with how people think and see themselves. And it's integrative because we use a variety of interventions or strategies, and they include from working on your personal energy to how you're eating, your exercise level, even utilizing things such as crystals, but it's looking at it from a holistic view.
Oh, okay. Well, thank you so much. I appreciate you being here and sharing with our audience. I hope you guys learned something this evening. Before we wrap up, do you have any final words for our audience or any advice?
I'd say my first bit of advice is, just because Google or WebMD is out there, it does not make you a certified practitioner. It does not make you a doctor. Make sure you ask questions. Make sure you get someone that is actually trained. I think all of us agree we want you to ask questions. We want you to have the clarity that you need. But I don't want people making decisions on their own that they just don't have enough information or data to make. And the other thing is from a mental health standpoint, there are non-medication treatments, and you can ask people about them. And when you see someone, especially a big thing for me, when you advocate for yourself and your loved ones, is any doctor you see should be able to tell you why they're asking you to do something. So any medication they give you, anything they ask you to do, they should be able to give you a reason why. If they can't give you a reason why, you may have to just try somebody else.
Okay, well, thank you so much. That's excellent advice. Of course, since we know we've been talking about mental illness, mental health, of course, I think no conversation would be complete, obviously, without talking about the National Suicide Hotline. If anyone is out there, whether it's yourself or a loved one, is having any thoughts or an active plan to hurt or harm yourself, please ask for help. There is a National Suicide Hotline. The number is 1-800-273-8255. Again, that number is 1-800-273-8255 for the National Suicide Hotline. Thank you so much for being here, Dr. Erika Goodwin. I am Dr. Renee Roberts, and you have been watching another episode of Medicine Makers. We will be back next week.